So now we're going to do a central line dressing change. So we have the PICC line right here. So to start out with this procedure, anyone that's in the room that's going to be in this close proximity to the line once the dressing's removed needs to wear a mask. So when you come into clinical with me, I will bring extra masks for everyone in the room. Whoever's doing the procedure, there is a mask in your kit. So first off, I have clean gloves, and I'm going to remove the dressing, coming up from the edges first, not exposing my site before I have to. So with a PICC lines are not actually sutured in. So the only thing that's holding them in place is this little contraption right here called a stat lock. So the stat locks have these little windows where you open them up. And then you can remove the PICC line out of the way. Remember when you're doing this on a patient to take note of how far the stat lock is from the actual insertion site. So you don't want to put your stat lock way up here when it was down here originally. You don't want to put it way over here, stuff like that. So kind of make a little mental note, where is it? And now we're ready to open up our sterile kit. So I'm going to open this up, which I've already kind of opened it a little bit for demo purposes. This is the same type of kit that we have in the hospital. I have my mask, so I would put my mask on at this time. I'm going to leave that off so y'all can actually hear what I'm trying to tell you. Alright, and then I have my gloves, which are down here, so I'll slide those out, put those to the side. These two things have fallen out of my sterile field, so I'm going to remove them. I don't need them anyway. Now before I put my sterile gloves on, there is a stat lock that I need to add to my kit. So I have to sterilely open this and drop it into my field. I want to come up and above. So you don't want any of your package to touch any of your field. So now I'm done with that. So now I'm ready to put on my sterile gloves. Alright, so now I'm ready to start with my care of my central line. So kind of filtering through some of this stuff. Now I have to be very careful. I can't touch anything on the outside. I can only touch inside this kit. I'm going to find my chlorhexidine, invert it, and squeeze. And I will tell you all the time, pop it like a glow stick, and you'll see it starts to get wet. And you can see it's, I don't know how well you can see it on the video, but it'll start to get wet on the mannequin here. Please make sure that you clean the actual insertion site. What I see a lot of students do is start over here with their cleaning. Start on the insertion site. And with chlorhexidine, literature says you can go back and forth. So we're going to clean the site, clean all on top, clean under. Alright, so now I'm finished with this. I can't set it down. I'm sterile, so I have to drop it from 6 inches above my area. The next thing I would do is my skin protectant pad. This is your skin prep. This is the sticky stuff. So when I open this up, it's going to get my gloves really sticky. It's going to make the skin really sticky, but it's going to protect the patient's skin from the tape that we're going to use. So because this is a mannequin, I'm not going to do this step, but we would open this up and put the sticky all over. The next step is I'm ready for my stat lock. Remember what I dropped a little earlier? This is my stat lock. It opens up with these two tabs. Grab one in each thumb, and it opens up kind of like a butterfly band-aid. It shows you little arrows, so it's kind of dummy proof, but sometimes people forget to look at the arrows, but the little lip goes on top. So you're going to open it like this. Now in the hospital, I will actually be helping you to do this, and I will move your central line kind of to the side for you. So you'll pull tab 1, push down, pull tab 2, push down. And I'll grab my central line that I've cleaned. And there's little holes on your central line that go with the little blue holes on the stat lock. And you kind of have to go fishing a little bit and ring the holes. Now I need to shut my windows, so I'm going to push with my thumb and push down. Now this is a part that tricks up a lot of students. You have to push hard. And on some of these patients that have very frail arms, they don't have a lot of muscle mass, you have to push really hard. So push down hard. Don't be tempted to come around behind their arm and push together like that. You'll break sterile field. So my stat lock is in place, my PICC line is secure. Now I'm going to place my BioPatch, and it looks a little bit different, various packaging, but this is a chlorhexidine embedded round. So the ones that we have at the hospital have a blue film, so I'll always tell you blue to the sky, so this one's going to be black, so I'm going to put it right on my insertion site. It's got a slit in it. Do not be tempted to try and loop it around the PICC line. Just put it. Done. Just place it. Now at the very bottom is my Tegaderm dressing, and I want the BioPatch to be in the center of the clear dressing. I'm going to open it up and place it. I'm doing mine kind of crooked a little bit because of how the mannequin is, and sometimes you have to do that with, depending on how patient's body is, how their arms are, or where their line is. So now the sterile part's done because I've got my dressing covered. It also comes with an anchor, so a little section with a V in it. And this is to keep your line, the tubing, see how it's pulling the dressing already? So I'm going to put the V all the way up on top of my dressing and peel off the back. The next step we would do is, while we're actually in the hospital, we'll change all of these caps because they have to be changed with every dressing change because they get blood accumulation in there. So we would change the caps, flush the line, and then of course date, time, and initial every dressing that you change.